Welcome to Raphal Medical Center. This is where we share health tips on a daily basis with our cherished customers and clients. Today we are here to address another important topic about practical questions and misconceptions about hypertension management. So the first question is, can I start taking hypertension medications on my own if I think I'm recording high blood pressures? The answer is no, because it takes your clinician to be able to diagnose you of hypertension. Recording higher blood pressures on your own alone, it's not enough for you to go over the counter and just start taking medications. Your service provider or your health professional is supposed to have a discussion with you about other health or underlying health conditions, whether you have hypertension, diabetes, sickle cell, because some of these underlying health conditions pre-inform how your treatment plan is supposed to be, and therefore don't self-medicate. We all know that it's not easy taking medications on a daily basis, and therefore once you want to start your patient on hypertension medication, the question is, for how long? Am I going to be cured? Unfortunately, hypertension, as we all know, is a chronic health condition, which means that your treatment plan, or probably you need to be on the medication for quite some time. And then your clinician will monitor your medications, will monitor your basic labs, will monitor how you are responding to treatment, and then will decide as to whether you are good to be weaned off your antihypertensives. And therefore, you can't just start taking your medications just because your blood pressures are now recording normally. With the medications, individuals as we are, somebody is hypertensive, he's on just one medication, somebody is on two medications. You might be taking your medication on a daily basis. I might take my morning and evening. Remember that because we are individuals and we have different health issues and we respond differently to medications, it is always good to stick to your treatment plan or your treatment regimen. Whichever plan your clinician have with you with your medication is unique to you, because that plan has been chosen, that regimen has been chosen based on your individuality, based on other factors. So don't say, because my wife takes her medication once a day, why am I taking mine twice a day? It is always good to discuss these things with your clinician and go by the treatment plan. If for a reason you have any challenges with following your plan, it's always advisable to discuss with your clinician, and then together you can come to a compromise and see how you can still continue with your medication and get a good blood pressure control. The issue with kidney failure, now we have a lot of people out there with kidney failure. You might not know, but the truth is that as young as 32, 35, 36 are now having kidney failures, stroke, and other complications that goes with hypertension. Unfortunately, the news out there is that hypertension medications gives or leads to kidney failure. Rather, but the truth is that once your blood pressures are increasing, you put a lot of pressure on your kidneys and other vital organs, and that is what can lead to this kidney failure, stroke, myocardial infarctions, and heart attack. But if you are start on your medications and then you obey or you are able to follow the treatment plan, you are rather reducing your risk of you developing a kidney failure. The good news is that most of the antihypertensive or the hypertension medications have renal protection. What it means is that these medications rather gives your kidney some protection from other distractions. So what we are saying is that this medication gives an extra protection to your kidneys. So once you are on BP medications, you are assured rather that your risk of getting kidney failure is rather reduced. Another thing is that if you follow your treatment plan and you have contact with your clinician is able to monitor your pressures, your clinician is able to follow up with your lab, and then most of the time, every year or mid-year, you go through series of diagnostic investigations. These investigations are done to assess how your kidneys are functioning and how other vital organs are functioning. It assess your risk of other complications like myocardial infarction, stroke, and then prompt interventions are given. So you see, the next time you run out of your antihypertensives, don't get them over the counter. Contact your clinician. Let him be able to follow up to know how your pressures are doing so that your treatment plan will continue effectively. When it comes to the issue of sexual libido or low sex drive or impotency, this is where we have a lot of challenges with our male patients or our male clients that are on antihypertensives. There's the news out there that the antihypertensives causes impotence. What we don't know is that the high blood pressures themselves or the hypertension itself can also lead to low sexual libido or low sexual drive. If you start the medication, as individuals as we are, it is always good to go back to your clinician to discuss any experience or any challenge you are facing with regard to your medication. Don't just stick to misconception or don't just be attracted by misconceptions. Always remember that our mind have a bigger control over the body. Once you capture this in your mind, you start taking the BP medications and psychologically you think you are even having a low sexual drive or you are getting impotent. But trust me, it's always advisable to go to your clinician, discuss your challenges. And remember, there is always a treatment plan that works just for you. Thank you.